From Colombia, Yolanda Corso Murillo from Sindes. From Peru, Wilfredo Ponce. From the Dominican Republic, Matías Ofreda Mutra. From Dominican Republic, Yunacer Francisco Garcia from Dominican Republic. From Switzerland, Uniglobal Union, Janet Astor. Marina Dura, Uniglobal. From Uruguay, Jorge Bermúdez de Fus. From Uni Americas in Uruguay, Marcio Manzanet. From Uni Americas Uruguay, Lilia Rodriguez. Kathy Leish from USA U775. Mariana Morante, USA. And Andrew from USA. Be very welcome. It is our pleasure to have Norma Liliana Rodriguez Arguelles, the chairwoman of Santiste. Let's listen to her message. Be very welcome. Good morning to everyone. It is my pleasure to have you again here in this international room, Julio Cortázar Terrazas, in our headquarters from Santiste. I would like to thank the Presidium, but also I would like to thank to all our international guests that were, as Claudia mentioned, thank you for being here in this important international forum. I would like to invite you to send your photographs. Those who follow us in the platform, you can send it to jornadasentiste@gmail.com, so we can create a video that we're going to show at the end of all the activities that we're going to have during today and tomorrow. So we kindly invite you to send your photographs to this email. Of course, lives go by really fast, and so we just want to leave our footprint. So we're going to be working, empowering, developing, and training our care workers, creating sustainable relationships to transform their working conditions and life conditions. Today's panel is a representation of the workers. It's the voice and the rights of the care workers. We're going to start our panel, and we would like to ask our panelists to come to the Presidium, please. Thank you. Good morning. Buenos días. Me llamo Janet Armstrong. Yo coordino Uni Global y Uni Cuidados. Es un honor para mí y es un privilegio estar moderando este panel el día de hoy, aquí con mis colegas, con mis hermanos y hermanas. Vamos a estar hablando sobre la representación de la Organización de los Trabajadores de los Cuidados, sus voces y los derechos de cuidados. Muy bien, vamos a empezar con este tema el día de hoy. Vamos a comenzar con uno de nuestros presentadores en línea. Entonces me gustaría si tenemos a Pierre Angelo, quien es el presidente de Unicare, de Uni Cuidados Europa. Buenos días, Pierre.
Es que tiene limpiado su micrófono. Un placer absoluto también a nuestro amigo de la Unión Mexicana. En Italia, el sector de la asistencia y los cuidados personales no desempeñan principalmente trabajadores.
So, the care workers are part of the third sector that belong to the health sector. In total, we have 2 million workers. So, when we review the workers in the domestic sector, we have 2 million domestic workers. This produces 2% of the GDP in Italy. Approximately 70% of the sector is made up of immigrant workers. 90% out of that are women. And it represents 80% of the workforce. During the pandemic era, there were a lot of difficulties because of the fear that we were facing about COVID-19, and it put a lot of pressure into this system. Many people, and then the relationship with the care workers. Many of them lost their jobs, their wages, the access to food, and they lost their jobs, and they were not able to go back to their homeland. The experience in Italy of the national bargaining, and one of the biggest challenges besides bargaining is the change of the demographics in Italy. It has caused the union activities to rise in the healthcare system. We have also consolidated the reserve employment in the high classification employment. In the last 20 years in Italy, we have worked with care workers at home, and they have been able to be part of the unions of some other sectors. The direct assistance to them is via a national contract of domestic work, and it have a bargaining. And it covers the needs of the workers of a sector that has become more essential in our country, in Italy, where these services are given into the good hands of these people. So I must highlight that the work that these people do on a daily basis, supporting and protecting the family, protecting the elders and kids and children. The contractual relationship has brought important innovations, especially talking about the market and how it works. Also training of the workers and the distribution that we have had in a system where we have a minimal wage for those people who provide care of kids from 0 to 6 years old, and we acknowledge that the people work at their homes, and the new contract defines the classification of the family members in 4 levels. For each of these levels correspond to specific parameters in function of the knowledge and skills that they need to apply for the work that they do. Well, we clearly distinguish the work that we do from when we support family. When the caretakers support their families, it has also been acknowledged. We provide professional trainings. They can add additional hours for the permits that they can ask for professional training. And so this intervention is done to qualify the skills of the workers and to guarantee, to ensure that they are providing professional services. Contractual relationship is also reinforced in the sectorial bilaterality in the certification processes. So, we have an additional contribution for the contractual assistance to apply to the people who require the services, to their families, as well as for the workers. The sectorial bilateral organisms also work during the long lockdown overall at the moment to stop the COVID-19 spread. We had a national negotiation for domestic work, working with NGO Mexico Without Borders. They shared their experience of the pandemic with us. They set up a series of information service that we apply to the workers. And so, during this year, we put together everything of a domestic worker and a private contractor need to know to provide this kind of services. We also are supporting women who are victims of violence. We want to reduce the risk at which they are in their working environment. Unicare, Uniglobal Union are promoting initiatives all around the world to talk about these situations, and the idea is that elder people have the right to decide and to be respected and included as a member with full rights of the society. The right of elders to control their preferences and to their decisions to be respected. This right to decide, and this need to come together with the right to have the social recognition and economical recognition. These two rights are the key factors for the development of a service of good quality, and that they are included into society. This makes the society to requires the society to change the focus that we put on elders. We need to be capable of putting the value of our global strategy, where we are going to be respecting the rights of both the workers and the users, and to create mechanisms of the access for the long care services. We need to pay attention to the structure and to the resources for the long-term care. The Italian bilaterality experience is a good reference point to build up both the resources, both the economical resources and the social resources to be properly applied. And so we need to have the capability of defining the strategies and to present these strategies to the big multinationals all around the world. But also, we need to work with the society and the unions who are taking care of elders. Thank you for your attention. Muchas gracias, Pier Angelo. Fue una gran presentación. Creo que hay algunos puntos importantes que se mencionaron y que me resonaron a mí, que creo que son muy importantes, que es la demografía de los trabajadores en el sector de los cuidados. Y en muchos lugares normalmente son trabajadores migrantes, y si es una industria dominada por las mujeres. Entonces se está viendo muchos cambios. Pier Angelo también habló de los
organising and representing workers. I think that's such an important factor because that's where their power is, right? And so if we can help workers understand their power and acknowledge the important and essential work they're doing, then that's a real key to moving forward with organising. And at the end, Pier Angelo was also talking about some of the work of Uni Global and the importance of global advocacy to assist with organising and representation of care workers, and really changing and pushing the narrative around the world about care and care work, which I think is why this conference over these 3 days is so profound. So congratulations to everybody who is bringing this together. We will have time for questions at the end once everybody has done their presentations. So next I would like to hand over to Andrew Bean. Andrew is the Vice President of SEIU 775 in Washington State. Thanks, Andrew.
Is it working now? Thank you for having us. It's been an incredible conference so far. Thanks to Uni for inviting us. My name is Andrew. I'm a vice president at SEIU 775 in Washington State. I work with Mariana, who presented yesterday. We represent, our local union represents 50,000 caregivers in the northwest corner of the United States in Washington, Montana, and Alaska. And I appreciate yesterday the grounding in the gender and racial dynamics of care work. Our members, 20 years ago when we started our union, our members made $7 or less an hour below minimum wage, but were not treated as real workers. It was a cash payment. They didn't have health care. They didn't have paid time off. They didn't have vacation. They didn't have protection from injury at work. It was really none of the benefits that workers typically had. And these exclusions were explicitly because it's an overwhelmingly female workforce. It's disproportionately Black, Latina, immigrant, Asian, Pacific Islander workers. And so when we set out to organize, it was really, the hard part, as folks have noted, was that workers don't have a common work site to organize together. The hard part was finding the people. The hard part was not getting caregivers active and engaged when we managed to talk to them, because their working conditions and their wages and their benefits were so poor. And also caregivers, many of our members are family members who are paid to care for their family members and are as interested or more in engaging in activism around the care that the people that they care for receive, that their family members and clients receive, as their own wages and benefits. So over the last 20 years, we have managed to get people, as Mariana said, to $22 to $25 an hour with health care for themselves and their kids, with holiday pay, vacation pay, and retirement. I want to talk about sort of the organizing work that goes into getting us to that point. Our members, the good part about home care organizing, the hard part is no work site. The part that's good is our members are in every corner, every district of the state, in rural areas and urban areas alike. And so when we want to engage, when we engage legislatively, we are able to have face-to-face conversations between caregivers and every legislator, every politician, and every part of the state. And the way we do this, and I think the key is that we find caregivers, we help them learn how to share their own story, we help them learn how to engage and talk to politicians. And structurally, we have a team that's fully dedicated to this. So we made a decision years ago to separate out sort of the representation side and the leadership development side. So if you have a question about your contract or your benefits, you call a call center, because it's hard for people to go into an office somewhere, but there's a separate team that's fully dedicated to helping reach members, get them active in their union, and teach them how to engage politically and legislatively, or in contract negotiations, or the other ways that our member activists drive our union. The other piece that's very important in terms of how we win, because all the funding for our work comes through the state government. Some of it comes federally, but most of the decisions about wages and benefits are not made by the employers. It's made by the state and how much funding is available. So engaging in politics is super important, because we can win so much legislatively, but we have to make sure the right people are elected. And we've been fortunate in Washington state to have just be in one of the most progressive parts of the United States, but it still is a struggle on a year-to-year basis to make sure that people that support caregivers are in office and that people that don't are out of office. So much of our work in member engagement is around politics. And there's a long history in our union of direct action as well, of marches, of civil disobedience when needed, of sort of standing up to make sure that caregivers' voices are heard. And they've gone from sort of what we called an invisible workforce into a politically powerful force in the state of Washington. So I also just wanted to address a couple other things in terms of how there's a question yesterday about how we sort of reach members and how we reach new members in particular. When a caregiver starts work, when they get hired, there's about 8 different ways that we try to reach them. When they start with their employer, they see a video from one of our caregivers talking about the union, have a chance to sign a union card sort of through the employer new hire paperwork. They get an email from us right away. They get a text from us. They get a phone call where they can sign up directly over the phone from a member activist. They typically call into our call center to sign up for their training or their health care, and we're able to ask them right then to become part of the union as well. And then, as Mariana mentioned, when they enter their sort of basic training to be a caregiver, we have bargained a 30-minute time to do a presentation about the union during that training. And finally, if none of that works, they get a knock on their door from another caregiver to talk to them about the union. So we know it's hard. The hardest part is finding caregivers, engaging them is almost easier. It's all these ways that we make sure that we talk to folks when they first start. And then finally, a question of like how we deal with political polarization in the United States. You know, we've been fortunate, like I said, to have a couple decades of progressive leadership that could change on a dime in our state and other states where they've organized home care. A new governor has come in and taken away a lot of the rights that people have won. And so it's really important to us to continue to innovate and make sure that we have as many people signed up to be members and active as possible, because that's our best defense against a changing of the political situation in our state, but also to think about things like the rate setting board and institutional ways that our caregivers have a voice in their sort of wages and benefits and in the rates that go to pay for care at the state that can't easily be taken away. It is, you know, an ongoing problem. There was an attempt by President Biden to pass a national plan around care to make sure that folks had training across the country, had access to higher wages and unions, and you know that came close but fell apart in the Senate because of polarization. So the ongoing work to organize across the United States certainly faces barriers, but we've been able to also organize in some more conservative states like Montana and Alaska that are much more rural. And our experience is if you can, you know, focus it in on caregiver stories, and we can reach more conservative lawmakers as well, because like I said, people, every part of the country has caregivers in it, every corner of the country, and we focus it on the caregivers and the people they care for, we're able to move policy and legislation even in more conservative areas. Thank you.
Gracias, Andrew. Sí.
SEIU have made in Washington for care workers or with care workers by getting organised and through that political activism. And I'm definitely inspired after hearing your presentation. I'm kind of taking notes to send back to my old union back in Australia, actually. Really interesting to hear some of those strategies you're using, so thank you. Next panellist we have is Jorge Bermudez. Jorge is the Secretary General of FUS in Uruguay. Thank you.
Los buenos días a todas y a todos.
Good morning, everyone. Again, it's a pleasure for me and the organization I here represent, FUS. And it's my pleasure to be here. Maybe yesterday we were in a rush and I didn't mention, but I cannot sit here without acknowledging the Mexican people and their rich history. Being at the land of Zapata, Villa, Benito Juarez, and Lázaro Cárdenas, for me it's an honor. And I continuously have this in my heart. I praise Mexican people. The construction of a caregiving national system is quite complicated. I'm not telling this. It's you need documentation, and each and every participant that yesterday expressed themselves, and maybe we will continue expressing the same concept today. In this complicated task, we have to get to these political definitions. Talking about building a national caregiving system that is to be managed according to the rules and interests of the market will lead us to no construction of any national system, because the market has only one purpose. The purpose is the rent of capital. Therefore, they are the enemies of the state. I just can tell you that in Latin America, you are neighbors of this country, but in Latin America, we have sustained dictatorships and this type of governments that have provided privileges to the market above any other matter. In my country, we have this neoliberal, trendy market, the government, more market, less state, and this is like going back to the 90s. Brazil sustained during the pandemic this terrible neoliberal government. And today in Argentina, as we speak, they are having elections where one of the candidates is intended to privatize the whole state. The same establishes Vox in Spain. So continue with this conversation and trying to detach it from the economical, social, and political context at global levels. I think this discussion stays short. So from these political definitions, in my country, Uruguay, there is no caregiving national system. Like there are attempts, and such attempts took place under two stages. Since 2005 to 2019, we have these progressist social democratic governments that were bound to collective negotiations, bound to the workers' rights, and bound to creating different instances that would have allowed the society to empower themselves and face and tackle their own problems as society. Today, since 2020, we have now this neoliberal government going back to neoliberalism. And today, again, there is no national caregiving system because there is no attempt to having so. What we do have is this integrated healthcare system where the public and private sectors complement each other. To the point that citizens pay according to different characteristics. If we are married, single, if we have descendants, dependent children, etc. This letter is established on a per gender and age basis to make distinctions. And this is financed by the contributions of the workers. So workers can be, whether they operate in the public or in the private sectors, and this is distributed through the National Health Care System or Health Care Fund, that is the party managing the collected funds. And this is allocated amongst the service providers. So it is neither a state system nor a private one. It's an integrated system. Why? Because in Uruguay there are specific conditions, like their own particular conditions. The private sector does not refer to these private hospitals. Like we do not have this split like private medical insurances, but of course there is this medical insurance for the most privileged class. We have this healthcare system that covered both the private and public sector, and workers used to go to the private sector if they pay taxes through Social Security. So I can talk about what we have. I speak on what I have lived. There are companies devoted to provide care, to home care services, hospital services, and these services are charged to the people. They charge a fee. Workers are organized in the Uruguayan healthcare system. As I was telling you yesterday, we only have one union, and we have this collective regulation bill. When Frente Amplio came down to the power, they established this collective negotiation act, where representation from one branch of workers is held by the union of this branch, and there is only one union per branch. In this case, the health care Uruguayan system covers all the workers of the private health care system, and they negotiate collective contracts and collective services. So they detached. Since 2005, they detached after a long reorganization process, hard work, until we got to have these collective agreements throughout the whole branch, like similar benefits for the whole branch, categories, and even a manual that of tasks for these care workers. This is where collective negotiation operates. This is where labor conditions, salary conditions apply. But again, these workers are not necessarily technical workers. Yeah, I'm bringing the microphone closer to my mouth. So yes, there is this category of nurses and companions as nurses, but most of them are trained according to the mere union organization set by corporations. And now I have a question. I will raise a question here. In Uruguay, we are trying to have this national health caregiving context. We haven't achieved so. with the government or with the social pension bank or the labor ministry or the public health ministry. When this process that was in favor of workers was interrupted, everything stopped. So in Uruguay, home workers, which are mostly women, have their own collective union, their own unionized organization. Home workers integrate what can be appointed as workers of caregiving sectors. In Uruguay, this is not the same. Home workers, house workers, have their own union, they have their own regulations and their own negotiations. And their tasks are not the same. The same that caregivers are currently negotiating. I don't know what is happening in other countries. I'm hearing you, and I'm raise my hand as ignorant in this subject matter. I am just pointing out the fact that this is not happening in Uruguay, and it was not set to be so. If we are having a caregiving system, house workers will be having their own union, their own labor conditions, and their own working conditions and regulations. They are not the same, and they will not merge. So, to wrap up, in Uruguay, when you hire someone, it will be on individual conditions. This unexistent caregiving system, but there are actually caregivers, so they are hired on individual basis. This will be an individual, and back then there was like this registration at the Social Ministry of Labor, and people would go there directly to hire caregivers, people who would take care of them in different fashions. But as previously stated, most of the time, populations directly hire any party. What they do, this contracting party will pay a salary to this person, should pay social security. There is no way of working without having access to social security and a salary. If there is an evidence that this is actually happening, then the state is compelled, let's say, if it's social security, then this person will be on trial, because they are avoiding the taxes and their obligations. Of course, there are areas in Uruguay, and there are people working for only a few pennies in the rural areas and in the big haciendas, big ranches. But again, this is part of the privileges, social privileges, and the distribution of wealth. But again, this is not falling on the majority, and this is not complying with the law. So, we do believe that Constituting a national healthcare system should be one of the priorities of the state, and the regulation should cover or should include different ministries. Workers should be represented through a union, in this case PIC-CPT, and the corporate sector. I think it will be easier going on creating a national system where all instances are integrated and not having this directly only with the state, because there is a private sector and this sector should be sitting on the table of negotiations. So this is our vision, this is our experience in Uruguay, and I do believe, since we are all union leaders, we have this quote: we do not do magic, or we do not show our secrets to other magicians. So the right of workers, it doesn't matter, it's the best democracy. We should establish strong unionized organizations, and it will depend on the coordination of unions. So having these concrete and specific actions from different unions and different countries, I think this is key, at least for us. I don't think that there are so huge differences amongst workers, so that we cannot get to common agreements from different countries where there are more than one union or unionized organizations. So once again, thank you for giving me the floor, and this is what I have so far. Now.
Thank you, Jorge. Thanks for sharing the experience in Uruguay. And also for raising that challenge to us about how can we all truly unite across all the different parts of the care sector, because there is absolutely power in unity. And I think the other thing that really has stuck with me from your presentation is in the beginning you said that the market cannot lead the reform in care systems, and that's absolutely true. It should be a state responsibility, and worker voices should be centred in that decision making and in that conversation. And I think it really underscores the urgency of our organising and our political work at this point in history. Thank you. Next we have Kellyanne Orr. Kellyanne is with Unifor in Canada.
Thank you. So in Canada during the pandemic, we actually, we saw an uprising of unionization, especially workers in hospitality, healthcare, and retail. And I think, part of that is the reason why is still okay. Part of the reason why is, they felt exploited. Their working conditions were terrible. They were forced to work long hours, many days in a row, and they felt unsafe. They saw in healthcare especially, they saw their patients dying, their families and friends dying, and yet their employer wouldn't provide proper PPE. So they felt unsafe, and I think that's one of the reasons why there was this big uprise of unionization. Those that were without a union also, lost their jobs quickly in some sectors. There was no recourse that they have with a union. So especially, as the pandemic hit and workplaces closed. I think they also saw that, the non-union folks saw the union starting to fight for pandemic pay and, proper PPE and an adequate supply of PPE. And, they wanted to be involved in and, have those safe workplaces as well. So also, what we in Canada in 2021, we came together, all the Canadian unions came together, and we created a World Day of Decent Work, and that's on October the 7th. And what we did is we called upon the federal government to focus on workers and their for pandemic recovery. So to ensure that, you know, that lost jobs were replaced by better jobs. The pandemic had highlighted existing inequality and precarity in the Canada's job market. It did shed a light on the pervasiveness of work defined by low wages, unstable hours, lack of access to basic employment rights. And COVID-19 had such an impact on marginalized workers, for sure, including women, racialized workers, and workers with disabilities. Some of the hardest hit workers were employed in precarious, low-wage and frontline work, such as home care, retail, tourism, education, childcare, and hospitality. And women particularly, and racialized women, tend to be overrepresented in all these sectors. So Canadian unions demanded that the government develop a more robust job plans, full-time employment, decent work for all. Whether you're unionized or not, we were fighting for everybody. And we challenged the government by trying to strengthen our social safety nets through investing in affordable housing, childcare, that affordable childcare, and in improvements in our unemployment insurance. You know, we were successful. We got a child care program. So in Canada, our child care is very expensive. It's $10 Canadian dollars an hour if you want to put for one child, if you want to put them in child care when they're not of school age. So for somebody that makes minimum wage in Canada is $16 an hour, $15 an hour. And when you go to work for $15 an hour but have to spend $10 an hour in childcare for one child, you just don't go to work. It doesn't make sense. So we were successful in getting a $10 an hour, $10 a day childcare program in Canada. So that both parents can go to work, because it takes two people in order to afford to live with the uprising of costs in Canada. So some of the things that we've been doing, you know, to increase unionization, and we've had a lot of difficulty with unionizing home care workers, most of them marginalized workers. So, you know, we, of course, are trying to use social media. We use Twitter and TikTok, and we talk about our successes. We've also, started, workshops, trying to, teach people about their rights and, how they can access their rights as a worker. We try to provide them safe space. Zoom is wonderful, where they can feel safe in their own homes and be able to have dialogue with the union at the same time. So certainly, it's been very difficult to unionize home care workers because also of the they leave and they go and work somewhere else, so they get some experience and then they move on. And we see that right across the healthcare sector, because jobs are plentiful in Canada in healthcare, and you can go from one workplace to another. And I think employers are seeing that, and they're trying to keep their workforce, because training and new workers is difficult, and trying to find workers is difficult in Canada. So I think that's helping stabilize a wage. We are pushing for wage parity so that if you are a personal support worker, whether you work in home care or long-term care or retirement home, that you're paid the same wage, to stop the job jumping and looking for the higher paid wage or a decent paid wage, and of course bringing up that wage is imperative. These workshops, by learning from each other, we need to know, what is their situation at work, how are they being exploited, and, sharing each other's experiences and I think makes all workers stronger. And by demanding decent jobs, lifting wages, and demanding safe workplaces, justice and peace, that's what everybody wants. And I think, in Canada, we just, we decided to take a grassroots approach and, not just defend unionized workers, but defend all workers. So thank you.
Thank you, Kellyanne. It's really interesting to hear. I think that COVID, or it sounded like you were saying that in many ways COVID was a catalyst really for workers to get organised, and perhaps that is the silver lining of the pandemic, and the question is how can we keep that momentum now, right, and keep moving forward with those opportunities. Hopefully in the Q&A we'll get to hear a little bit more about some of those innovations, because I'm sure lots of people have questions about your work in Canada. Thank you. Next, Sister Ruth, are you ready? Yes? Excellent. So next up we have Ruth Diaz. Ruth is the President of Fenamutra in the DIA.
I'm sorry, mic is not working. Okay. And now we can hear you. Well, I said some words in English and then I said good morning. For us, it is our pleasure to share the space of this panel with such experienced people, to be able to share and exchange experiences, to get to know what is happening in different unions or different latitudes of the world. And we might be facing the same challenges. Nevertheless, the local experiences do not take away the reality of what we need to face on a daily basis. I would like to set up the context for I will tell you about. I will mention some stats, some figures on how are we doing in Dominican Republic in terms of the labor force. The last survey that was run in 2024, it is a national survey of workforce. And according to the central bank, the results show that around 4,077,000 people belong to this sector. Not necessarily employees, but people in a productive age that were employed, actively looking for unemployment. 1 year before that, in 2021, according to the rate of the Social Security, we were about 2,096,000 people who were paying taxes as workers of the health system. We are around 11 million people in my country. It implies that 60% is not included in Social Security. It might be that kids are represented in 2 million workers because some depend on their families to have insurance. But individually, most of the people belong to the gray work. And so our national union with the different unions, because Fenamutra, it is a second grade organization. We have first degree organizations, which are the unions. We are a federation. So what we represent is the domestic work, the child care, elders' care, and part of the health system. We are the only organization in the Dominican Republic that puts together all these sectors. But since we're an organization with the goal to work in pro of women, we started working in the sectors where women have more representation, where we actively working. Maybe today the care is in fashion today, but this is a situation that we have already identified since a long time ago, and we knew the needs. Currently, we do not have a national care system. Nevertheless, the Dominican government has put its efforts to create a pilot that we are trying to articulate and to develop. And since we didn't have a single thing, we included the workers of the domestic sector and housekeepers, because we understand that these people, these women, are caregivers indirect, but at the end of the day they are caregivers. So the FIC representative yesterday talked, she kind of deep dived into this topic. It is clear that we have different categories regarding caring, and we also understand that there is a degree of specialization that should be acknowledged as such. Since we don't have a system, since we do not really have an integral caring system, we have been able to see, and you're going to be able to understand the difficulties we're going through. If in countries that we have listened to with developed economies that already have this system and still they are going through some complicated situations, imagine what we must be facing at this very moment with this situation. Out of those 2 million workers that I mentioned, FENAMUTRA has around 13,000 people that are directly into the union. Most of them do not, because they belong to the informal sector, and it is one of the biggest challenges that we have to set up a union fee to people that can actively come to you when they have a massive activity or when there is a specific situation that is against them. But actively, we have 12,000 workers on the records on our federation that work under the policies that we have set up for the national territories. So, we, as a union, and the government, when the government started talking about this pilot caring system, we were not taken into account. We just raised our voice, and that was the only way that we started being included in these working tables for the pilot. Now we can say that we're part of the local group and the national group of work, and we are invited actively to build up this proposal. And so we had the opportunity, the real opportunity, to start writing down all the needs that we have. One of these needs was the situation during the lockdown. We are the representatives of the support workers, cooks, managers, janitors. And so if it is true that it is not directly involved in the caring of people, it is not less true that without them, the patient wouldn't be able to get into a clinic, you know. But it is not included in the Dominican Republic. Sadly, after the lockdown, after the pandemics, the wage was supported by the government, but all these people were left out of this standardization of wages. In the Dominican Republic, we also have a nurse representative, and Mercedes works with us in all the areas for the support services. I mean, all the mobilizations that we did were during the lockdown. And I mean, a lot of the doctors, they could talk over the phone, they could talk to people over Zoom, they could provide medicine through Zoom. Nevertheless, the janitors, the people who cooks, the people who pays the bills, they needed to be at the hospital, because without them, the hospital would just be turned down to rubble and it would stop working. And they were earning less than $200 for a month, and that is a minimal wage. And we, with all the mobilizations, with the protests, we achieved to work out with the National Coordinator of Health to talk to them, and all the people who belong to the nurse system, they joined us, and somehow we achieved to have a working group with the president. We had the chance to talk to the president. With my brother Garcia, we were in a meeting with the president, and a lot of our union members chose us as a spokesperson, and we had the support of the doctors, of all the technical areas of the clinic, of the nurses. We had their support, and we were designed as spokespersons. And so we talked to the president, and we set up a working group where we started presenting our demands for the health sector. An important piece of data that is important is that the collective bargaining for the public sector should be approved at least by 60% of the workers, so you can sign a signature, and it just represents just one profession. And it is through the mobilizations and through discussing that we can achieve to sign off these collective bargainings. We have put together 20 professions that belong to this provision of our demands, but historically we achieved to set an agreement. We achieved to fight for our retirement funds. Our federations, for the first time in history, to the supportive staff, they were recognized for having the benefit of the retirement fund at 100%, as nurses and doctors would do. And we got also retirement funds for some of our leaders. And so it was one of the biggest achievements that we did. But the changes is the workers were working $200, and we could get the retirement fund for $400. Not even our sector got us 100%. We got more than 100% in our sectors. But still, we do not have the wage that we want to have. If there's something important that I can highlight from Bermudez, he says that through unity, that the real benefits for empowered workers is through unity. If we haven't get united with all the other professions, we would have not been able to put together these benefits for our services, brothers and sisters. We got an increase in the wages for the health workers. We have started a campaign to get a minimum wage of $400 a month, because if I have already have my retirement fund insured with that, it is not possible that the retired worker earns more than an active worker. This campaign is in the social networks. We have gathered more than 3,000 signatures from workers and more than 5,000 from some other actors that support this initiative. Certainly, it is something that has to do with the budget, but we also understand that it is something that has to be with our guarantees. Nobody can work with $250 for 30 days for a month with a cost of living, at least with the basic basket in the Dominican Republic. I'm talking in terms of dollars, so we have the context and we can get the right idea. So we have the 5 quintiles according to the social level. So the basic quintile, it's around $500. So have an idea of the people who work here, what are the conditions that they are going through. So this campaign, we launched this campaign and we have socialized this with all the decision makers. And the situation, the barrier that we have found is the budget. Nevertheless, is that we understand that if we don't sit down with the working group that we have with the president, we are not going to achieve our goals. So we have thought of all the possible scenarios. So we are thinking about this incidence campaign. So in the domestic work area sector, our legislation did not take into account the housekeeping workers. It is mentioned in Article 4. In one of these articles, it is just mentioned that they are part of the workforce of the Dominican Republic and that they will have full rights as workers. But for all the other labor provisions, we get specifications. And since housekeeping does not fall in any of these specifications, it is in the air. And so we started demanding the Agreement 189. And the Agreement 189 was ratified, but it has not been applied yet. We didn't have a minimum wage for this sector. And part of the negotiations that we've been part of in the Ministry of Labor was to create, for the first time in the history, the National Board of Wages for domestic workers. For the public sector, the minimum wage is $200, as I mentioned, the healthcare system. So what we did was to establish a minimum wage for the domestic sector of 10,000 pesos. Of course, we are not satisfied. Nevertheless, we trigger a process. We started paving a path to provide social security for them. Currently, we are thinking about, like, if we already have a minimum wage, why, if it is the only requirement that we need for social security to get one of these people into a person who contributes to the retirement funds. Next Saturday, we're going to have a meeting with the domestic workers, with the Federation, and we have other 2 unions that are going to work together to demand this. We have invited the Minister of Labor to tell him that we're going to start with this campaign in pro of Social Security and that we're going to start working with our affiliates and partners to start doing the necessary mobilization, and we're going to let them know that the campaign that the government needs to do is going to be taken over by us. So on Saturday, we're going to start with this. We're going to be launching this campaign. Yesterday, we sent a video. My sisters that are over there, we are waiting for a forum of 500 domestic workers and the executive boards of the 3 unions. Regarding other sectors that are not less important, regarding caring for elders, caring for children, as I mentioned, we have to directly start working for this to provide and to defend their rights. Diana Mejia is here with us, and the Dominican government through the National Council for Elders. She's going to talk to us how the government has been working and how we, from the labor part, we have tried to acknowledge the part of the domestic work. For nobody was a secret that when the Dominican government started talking about this, they were only talking about the benefits, the part of the right of the citizens to be taken care of. But it was not clear who was going to provide that right, the workforce, the human part that is going to do the job. And it is something that we have been working before the Board of Care. We have made already several proposals where we have been able to be listened to and taken into account. Of course, it is not always possible when we have more than 13 institutions. It is complicated to set up proposals in which we all reach an agreement, where we strike a balance on the recommendations that we have made and their own proposals. We understand that from now we're going to start with the campaign of organization. And no general cannot be a commander without a troop. So the unions that do not have people, they don't have power of having the incidents or of getting people together. Now that we have noticed this possibility to be heard by the government through the healthcare board, that they respect us, that they understand that we have the capability to improve the conditions not only for our union, not only for our sector, but for the full country, and that we all reach better life conditions. Then from there it starts with everything that has to do with clear demands and specific demands to provide direct life quality to that staff members. Currently, we cannot say that in Dominican Republic we're working on the agreement 189, where new workers are going to start contributing for their retirement funds, and that we are not going to have any special conditions for the people who are 30 and 40 years old that have been working for that specific number of years, and not only for domestic workers, but also that this umbrella covers all the care workers. I'm really happy that CONAPE has this visualization on a program that we have never taken into account, which is Loving Families, Familias de Cariño. This is a program, it is a first initiative that we have set as a parameter to be able to provide and to ensure economical guarantees for the caregivers, that they have the possibilities that they can take care of a family member. Any person who needs to be taken care of wants to be taken care of by a stranger. It was something impossible to think in Dominican Republic. Now, what are we asking for this program? What are the requirements for Familia de Cariño? There, we are asking them to be part of the Social Security, because we started with a pilot plan with most of the minimum wage was over the minimal. I mean, they get $300, they don't have Social Security, and they have all the guarantees. Currently, we need that this caring part it's included not by cooperatives as they want to implement it. Nobody can supplement the three-party role of the government and the unions, and this caring role needs to be taken care as an additional service of the Social Security, since it is a fundamental right for the citizenship. Thank you very much for your attention.
Gran presentación.
Dominican Republic with Fenamutra. I really liked you talking about how the support roles are just as essential as the direct care roles in the provision of care, and it's, I think, really important that we don't forget that. And talking about the power of solidarity and the value of building allies to further support our organising work. So thank you for that presentation. Next, I am going to give the floor to Gloria Flores. Gloria is the president of FENISAP in Chile.
Buenos días, ¿se escucha? ¿Sí? Ya, vamos también... voy a referirme a lo que ha hecho...
I will talk about the tax achieved by my federation on behalf of workers, male and female workers in my country. I want to put you in context. All this comes because there was like this progress from UNI and the foundations mapping out and wondering if these workers were duly organized or pertained to a union. But this was interrupted by pandemic. But now in the federation we have to underline that during the lockdown we were cataloged as essential if we visualize the topic about caregiving. And this was so important, and it was established as something significant, because we had to leave house. Who was going to take care of our children, of our elders at home? It was so hard for us because we didn't have this caring money, someone taking care of our elders. So the situation was created, and then we had this situation for caregivers taking care of the children of the workers in the health system. This was this woman attending every day to these houses who were those having children, needing someone to take care of their homes and children. In pandemic, there were no paid workers with a specific contract, and this role is assumed by a relative, but in pandemic this relative couldn't make it because it was either the mother or another woman sustaining a chronic disease that couldn't leave her own house because of lockdown. So this person attending on daily basis that house couldn't make it, so it was so important. And this is when the union, FENASAP, our organization, requested the fact that in order to carry out this job, they should deserve a salary, taking care of the families, dependent families and children at home caring. And it was released for those caregivers who were sustaining a chronic disease, because we always say that life goes above any type of job and business. So for us, it was so very important to consider each and every member of the family. Just as Ruth established it, who was working at a clinic or a private health center, and like betting for this caregiving process and granting these services to the people. There were like lots of things achieved together with clinical workers, white robes, administrative people, hygiene, safety, administration. In particular in our country, they are outsourced workers. So whatever was achieved through the federation included all workers, even though they were having this contract that was not celebrated with the main employer. It was with those working in outsourcing basis with a given corporation. So they got some free days to recover their mental and physical health after pandemic, emotional distress, the situations with the family, these painful moments that were lived. And all this happened in the Federation. Everybody was included. Yesterday someone was talking about, I thought it was our peer from Canada. It was the people from the unions, from the Federation. This should be spread out in solidarity with all our parties, because this points out that the union will be acknowledged and will be like a life guarantee. So for us this is so important to connect with caregivers, to connect with those working at elders' residences. But then another important point, and this is not of minor importance because this affects the whole society. This is not a matter of men and women. Wherever there are women or a part of the society that are likewise members of our family and someone is affected because of a disease, and if they want to work or take care of their children or become a housewife, whatever, this actually affects the mental health of the society we want to heal. In Chile, we started with this study through Senama. We duly achieved that 1 out of 4 elders depend at some percentage of others. 100% of the cases, caregivers are women. 63,832 women quit their jobs to assume the care of elders or dependent relatives. And from this group of women, 2 out of 3 women have no holidays or vacations for a 5-year period. So just to put you into context, this labor is so important, and the Federation has encouraged these actions in an inclusive way. And we have to understand, because this is a social problem of workers, because we are kind of isolated in an island. Leaders are somewhere else. And the working class, they all have families. There is always someone you have to take care of. Someone is a house worker, others work in the healthcare system. So it doesn't matter if we work for the healthcare system, we understand that all sectors are important, and we stand up as a working class. So to achieve this work, we divided this into 3 different segments in a way of moving forward. So it was formal and informal jobs, and this has taken 2 pathways: identifying caregivers and identifying these jobs through incidents, action, and political roles. So we are present in all topics of interest in the society, and the topics of our interest, because this affects our quality of life. Formal workers, we have gathered with unions and leaders of unions. So by setting the future pathway for the following year, it is having this fraternity, this affiliation, having incidents together with FENASAP, and be capable of representing all these parties and being with them with their claims and including them into our working agenda to replicate their own voice at the same time. This data gathering, we set this national encounter to have this direct relationship with the different parties. It is encountering people living the same situations, living the same experiences. This is also important to create this belonging, these bonds, and being empathetic, to understand how necessary it is to be connected and to understand what is actually happening with workers in this sector. So this past May, we organized this long-stay national encounter in private centers. And this was for the purpose of generating bonds with caregivers and care workers in the health centers, both for private and public centers. This was relevant as well because they likewise deliver this health care work. And it is differentiated from housework because they are exposed to perform both duties because it is not detached one from the other. And this can also be established from the mere organization. So this exchange included the union work in this sector. The objectives of this, the goals of this meeting was to create this labor agenda, the outcomes to create these bonds with certain unions that were poorly organized and that they lack of this knowledge because they operate on their own in an isolated fashion, and they weren't aware that they could create these collective contracts. So with this event, we were capable of identifying the problems, the current problems, and the lack of training and labor regulations that they required, understand labor characteristics and unionized regulations, work in future affiliation for this in this union, so that eventually we could likewise elaborate this work together with them all. It is like an activism trend because sometimes we had to go to far away points and they work until under demanding labor conditions. And in this event, the leaders in the event gave their testimonials because they understood that this should be regarded as an actual job, like active listening, conversations, one-on-ones with these people, so that bonds were created because we have the same issues as healthcare workers in a different context, but we have this burden on us because we have to take care of our families. Listening to care workers, understanding the focus of the cares granted to the clients, and the chairwoman of the federation and the whole agenda understood the impacting and shocking testimonials because they were sharing the emotional distress they have to live due to the vulnerability and dependency of elders, abandonment, death, the situation of having these patients in the context, the psychosocial risk present at all times, because we have to underline that unfortunately there were many adult women taking care of elders and exceeding their own capabilities, moving patients, because there are no limitations on what their duties are, sustaining how to cope with aggressive patients. They have no training how to deal with this, and the emotional distress, of course, this emotional component included, because we all feel these weaknesses, and we understand how exposed we are to be cared by people under all these poor labor conditions. So at the Liam centers, it was underlined, the rapport with unions, they talked about, again, the contractual poor conditions, and the difference between being house workers at a private home, but at the same time they have to take care of dependent patients. And since they have no training, their contractual conditions are vulnerable. Lack of conditions from the government, and little attention to their claims. It is acknowledged the lack of training and the lack of participation from the unions. So again, with all these that we understand, we have to be present, we have to be active and encouraging, and gather and be with the workers that pertain to a union. And well, our dream would be to visualize and find all these freelance caregivers that having no formal job conditions, and so that they can come with us and start working, having the union's representation, together with all those caregivers that do have all these unionized characteristics, and to include them in the labor conditions for the next year in the private and public sectors. So if they join to this union, we can move forward in a three-party fashion, because of course, to get to the national system, caregiving system that we do need in the society, care workers, health care workers, visualize all this, but we need the willingness from the government, from the workers, but together with a strong unionized union and a well-organized one. This is it. Thank you very much.
Gracias, Gloria. Thank you for taking us with that presentation, I think beyond just the theory of organising, but reminding us about the emotional part of organising too. And I think one theme throughout your presentation was that organising begins with connecting and with building respect and recognition both ways between unions and the workers. So thank you very much. Next we have Licenciada Claudia Lorena Sanchez Bárcenas. Thank you, sorry about that. Claudia is the Director of the Centre for Wellbeing and Childhood Development. Thank you.
Buenos días.
Hello, good morning. I'm so very excited to represent my country in these premises. I'm here to share with you children's development and welfare system. And we will work on the perspective from the services provided by the Institute, services and insurance coverage for 124 facilities all over the country. So it's important to understand that since 1984, East General Regulation provides service to the children's facilities, and it was for the purpose of delivering these services for the welfare and development of children. So for this purpose, they were created for the children of our state workers. Article 4 establishes that it is mandatory to receive these services and benefits, and it is duly expressed in Fraction 3 that the services are mandatory, different from what we have been listening to so far these 2 days. And the operation of these facilities is part of the allowances for workers, abiding to this normativity and the institutional mission. There are different inputs of our regulation, and of course we comply with the federal laws, the regulation of the MIR Institute, the labor regulations for the protection and care of children, handbooks, organization, of course the general law on education, in compliance with this new Mexican education trend. And we have been certified with the ISO norm 9001-2015 that exhibits that we provide a service of quality. Additionally, we have this regulation that establishes to have these guidelines complying with the responsibilities of taking care of children and transcending in their own integral education and development. There are different protocols guaranteeing the significant interest of our children and in compliance with the labor regulations to provide and comply with the rights and obligations of our staff. So for the delivery of this service, there are different interested stakeholders. There are many, but for main above anything are children that are set in different categories. Breastfed children, infant and preschoolers. So the stakeholders are linked to beneficiaries, and this includes the workers, the state workers. Our staff is this representative and diverse organizations and institutions like the Ministry of Education that continuously monitors, provides feedback and certifies children during their first years of age. The Ministry of Health that continuously monitors the health condition of our children according to the integral development of these children. I want to also to tell you that at these facilities we have the infrastructure that will guarantee our staff will be fully equipped for this purpose. Likewise, we have CCTV and firefighting systems that guarantee parents about the safety measures that cover their children within the premises. And this is not only an interaction based upon the care given to children at our facilities, because at the same time we collaborate in the first educational roles for these children. So we have this organizational chart that is equipped with professionals and proficient experts, because on one hand we have professional white robe staff that will guarantee the health and education of our children, good nutrition factors. This is through physicians, nurses, pediatricians, nutrologists, educational agents that will be the heads of the groups and educators, and the services provided by the janitors and others. And as part of the strategy's health, it is important to tell you that key training is paramount for the delivery of the service, because in this dual representation, both with the authorities and through the union, we try to guarantee professionalization of our assets. So the participation be key, giving priority to their training and continuous updating of their duties. In these centers, we try to have this inclusive environment, because it is not only for healthy children. We have others with certain conditions, and our staff is duly trained to satisfy the requirements of such children. And all this is duly instrumented through the criteria that will guarantee their development through different processes. Being the main ones, the three axes I will now share with you. This service is provided through education. Primary care through planned, systematized and well-structured conditions, having an impact in the integral development of the children. Additionally, we have the food service. We have our own diet that will cover cooking and provision of the meals these children will receive, so they are covered. And these guidelines were developed in the nutrition school of the institute. Regarding health care, we have experts, dentists that keep track of the conditions of our children through different activities and campaigns, and likewise through different programs, keeping track of the height, weight, size of children. It is important to share with you that we are duly focused, and we have this quote: education is not to be ready for life, education is life itself. So it is essential to transcend in the children's education, not merely regarding simple caregiving, no, to make them become good and healthy adults. And this wouldn't be possible if we do not set the best foundations, updated, qualified care that will be present not only because we are organized in a union, but as the head of these facilities. I can guarantee that labor conditions are likewise a right for all workers at the Institute. And that this would show our appreciation for children at their first stages. We work with the best asset, your children. And for this purpose, the external and internal verifying and certifying, monitoring and supervising organizations, so that what we say we do, well, they confirm we comply with all these regulations in this organizational environment that is delivered for everyone.
It has been my priority that the rights of the children is our reason to be and the essence of our institutional mission from the perspective where we are looking at it. It is important to share that there cannot be a working performance without the feeling of being motivated and acknowledged. Thank you. Thank you. Me gustó mucho tu presentación y a lo mejor me dio mucho sentimentalismo porque también soy una madre y me gustó todo el enfoque que le diste. Y bueno, también desde mi experiencia de trabajo creo que no podemos dar servicios de alta calidad en educación y en cuidados si no tenemos trabajos decentes y si no nos apoyamos en ello. Entonces es por eso la importancia de organizarnos. Gracias por tu presentación. Me gustaría presentar a nuestro último panelista del día de hoy, Edgar Sánchez Hernández, es el psicólogo de Casa de Día del ISSSTE. Muchísimas gracias, Edgar. Adelante. Thank you for having me here. Thank you for all the people who are here. Talking about care, it's important to mention elders. During this period that we have been listening to several of your talks, we mentioned the juveniles, the children, but important to mention are also elders. In Casa de Dia, I am in charge as a psychologist. We want to create a proactive space where at the end of the day, we generate a contact with the elders. They have provided services being directors, managers, and part of our staff. So these senior citizens, they have the right to enjoy this part of their life. This is the reason that in Casa de Dia we want to generate this space. We want to create a proactive livelihood space. We have several activities: sports, education services, health services, and we want our seniors to be healthy and to be happy. Why do we decided to start this project? In the first place, population is aging, and we know that there's a growth in the population of the aging people. It's something we cannot avoid. We evolve, we grow old as people. So this aging and the lack of activities for senior citizens was the reason to open Casa de Dia. And the second point is that when they get retired, they are inactive. One of the factors that I acknowledge as psychology in this part of dementia, insanity, is because there's a lack of activity. On a daily basis, when we have activities, we have a cognitive stimulus. And this will keep our brains stable in different areas of knowledge. Besides Casa de Dia, during the situations that we have gone through where we haven't had activities for senior citizens, there was a creation of self-help in several clinics and community centers. We also promoted health in the different institutions and the creation of gerontologic centers and daycare homes for senior citizens, nursing homes for citizens. I belong to the first Casa del Dia, and it was opened on the 25th of June 2014. Up to this day, ISTE has 22 Casas de Dia. We have the different areas of the city in Estado de Mexico, Campeche, Chiapas, Chihuahua, Colima, Culiacán, Guanajuato, Hidalgo, Michoacán, Morelos, Oaxaca, Quintana Roo, Tabasco, Tlaxcala, Veracruz, Yucatan, and Zacatecas. At the end of the day, what we work for is that people are really into this job. As we're having an increasing population of senior citizens, we want to bring more areas and more activities into our nursing homes. In Casa Dia, we have 4 main activities that are divided in different areas: education, sports, occupational therapy, and health. All of this is focused in taking care of the biosocial needs of our senior citizens. Our educational services are elementary school and junior high school. We have an agreement with the National Institute of Education for senior citizens. We also have the high school, online high school, and sometimes we have some boundaries on how are we going to work out with this kind of education if we work with senior citizens. This educational part is also part of teaching them how to use a computer. We have beginners, intermediate, and advanced learners courses. Also, we teach them in the use and safety around mobile devices. Sometimes we have some workshops online and some in-person workshops. We have also information on technology courses. Sports. We have gerontologic workouts and some courses of to take care of their backbones, and we provide all the support that we can. We can include people in wheelchairs that have the adequate mobility or with any deficiencies. We provide yoga class, Tai Chi Chuan. These are some of the sports activities that we have in Casa de Dia. We have occupational therapy. We have different activities. We have a chorus. We have walks. We have tours, field trips, and also the health area. What we do is that we run a medical appraisal, and from that we offer different services for physical health, mental health, nursing, psychology, nutrition, and dental care. All of these are professional services specialized for caring of senior citizens. The agreement that we have an agreement with the National Institute of Polytechnics, IPN. for the social workers. We have also an agreement with University Tres Culturas for pedagogy area. We need to take care of the static aspects of them. So we offer podiatry services to them, podology services to them. So we have several activities. We have the chorus, and we promote the several activities that we work with in Casa de Dia. We also work in Convive. That is basically creating an interaction in Casa de Dia to promote the contact between the different Casas de Dia members. So the requirements are basic. We just need some ID, medical certificates, and 3 photographs. Our procedure is that we run an assessment by the interdisciplinary group to identify specific needs. If a person wants to come work with us, lost a family member, we are going to provide psychology support, and in case that there is any injury, we help them out with that too. It's important that with all the interaction that we have with these senior citizens is important because it's a two-way street. We learn from them and they learn from us. Thank you. Creo que estas son unas muy buenas iniciativas sumamente positivas. Me gustaría también tener un acceso a algo como eso cuando yo sea grande. No, pero muy bien. Creo que tenemos tiempo para 2 o 3 preguntas. No sé si haya preguntas por parte del público. Aquí se levantó una mano. Tenemos un micrófono disponible. Good morning, Francisco Garcia from Dominican Republic. So we would like to understand at this moment. They're getting to know that we have a lot of organizations that are not directly involved with the care workers, but that they support the organizations who work with these staff members, such as we are doing in the Dominican Republic. We have statistics, we have information, we have data. We have the union force on our side. So in the case of Rudia and Kaylee from Canada, I would like to know what is the strategy, the common strategy that we could follow. Gracias por la pregunta. Gracias.
Difficult in Canada to organized home workers. We're doing our best. Our strategies are, social media, trying to connect with the healthcare workers in home care, and just trying to do our best at making us sound worthy of getting their unionization by offering them stability in our contracts, but it's been very, very difficult for us, for sure.
Bueno, qué bueno, Garcia.
Garcia, thank you for your question, because in the strategy we included a C at least for the Dominican Republic. As well, last week there was a uni commission to try to make a plan of possible actions that help us provide a better coverage for this sector. In general, I believe and I think that we all, if there is a factor in common, is the incidence that we have on the decision makers and organization. A clear point that FENAMUTRA has is to reactivate the social dialogue with the President of the Republic, taking advantage that we're going to have the political campaigns, we have elections next year, so we need these incidents and to work with the President and the Health Cabinet, everything that has to do with the prerogatives that we have in requesting, and we all need to have a commitment there. All we who need to action to trigger in these sectors. Beyond our local actions, I think that in general, the incidents through social media, through the different territories will allow us to be in front of the decision makers, but also to create trust with our affiliates for them to understand that they are not alone. Gracias.
Alan, you have a question?
Yes, this is a question for Andrew. It's really impressive to hear the dramatic increase in salary and working conditions, and I think where you talked about starting is where a lot of countries represented in the room are starting, where care workers are receiving at or below minimum wage without any type of social security or paid time off. But one of the things that a few people were asking me about, and I think because it's very novel, it's coming from the outside, it's a little hard to get our heads around. Could you explain in a little more detail how the employer works, who that employer is, how it's set up, and how that works in terms of negotiating? Because I know they're not directly state employees, but it's not a private agency, that it's not a for-profit or non-profit private agency. So do you think you could explain that a little more? Because I think it's an idea that may be relevant for several of the countries as a way of employing home care workers.
Yes, I can do that. So the employer for most of our members is a it's kind of a quasi-private agency called Consumer Direct, but they're the people that they're sort of joint employees of this agency and the consumers that they care for. So the people they care for get to choose who their caregiver is and get to direct their work, but this agency sets their wages and benefits and all the sort of conditions of work through collective bargaining with the union. And I think the important piece of this sort of Kelly talked about the difficulties of working with for-profit agencies and not getting enough of the money going through to the workers, is that the state actually sets a specific amount of the rate that has to go into wages and benefits. So this private agency doesn't get to decide to take more money off the top, that they have to spend a certain amount of the money they get from the state on healthcare and PTO and wages, and our union gets to bargain with them to make sure that the workers have a decision in how that money is spent. So the state really sets a lot of the conditions of how much needs to go to the workers, but they're not the direct employer. And one reason for that is that the Supreme Court of the United States has really weakened the ability of workers to bargain in the public sector, and specifically home care workers. And so this arrangement works out better for workers to sort of have power through their union.
So it's an agency that was set up basically by the state, that is run by the families who receive the care, the people who receive the care. They are the ones who sit on the board of the agency?
No, the agency is contracted by the state. The agency is a private
It is a private
company.
agency. It
It's
is a private
actually a
company.
for-profit company that they ended up contracting with. But there is a sort of setup in Washington State where the workers have a little bit of power in the agency through some worker ownership. That's a whole nother complicated system. But it is a private agency. Just the state exerts a lot of control over how much of the money that they're getting has to go to workers. And then the individual consumers who might be family members, get to make decisions about who they hire and how, kind of direct their own care work, which is a very important feature of sort of home care in the United States, allowing that consumer direction.
And it's a single contract, correct? There's no
Yeah, it was very
there's no
important to us that it's
competition.
a-
There's no other agencies. It's not fragmented. It's just
Right.
the state selects one agency, and then that agency has to follow all the state guidelines for how the money gets paid to workers.
That's right. It's one state agency that employs 40,000 of, our 50+ thousand members. And that is more efficient for the state to deal with one company, and certainly easier for us to organize across one employer than a bunch of tiny ones.
Understood. Thank you so much.
Sí, yo lo que no me quedó claro ayer y me sigue... Lo que no me quedó claro ayer y me sigue... Entiendo perfectamente está el tema de los recursos que vienen...
The resources part, I understand that the resources are allocated by the government. There's an agency in the middle. What is not clear to me is like when we have individuals that are not getting, that they hire privately, who do they hire? Is there any regulation for those private caring workers?
That's a good question. We don't, we represent a small number of people that are hired privately, and those, if someone hires someone through an agency to work in their home to care for, their mom or their child with disabilities that doesn't qualify for state funding, then we would represent those workers if we also represented that agency. But a lot of people hire privately for work in the home, like domestic workers directly, and those folks are mostly not unionized and not represented and don't have a lot of rights. And there's a lot of work in the United States with the National Domestic Workers Alliance and other organizations to try to figure out how to represent those workers, but it's obviously extremely difficult to find them and collectivize, but there is a lot of work being done on that.
I just wanted to touch on that. In Canada, we have a lot of private nursing homes, retirement homes, home care, and they do have guidelines that they have to follow that's set by the government. So the Ministry of Health and Long-Term Care, and so they have the ministry gives them money, but they have to spend it in certain ways. So there's a nursing envelope, a dietary, like a food envelope, so they can't take money from the food envelope to put it in the administration's pockets, I guess. So they're not allowed to touch those envelopes for other than what the purpose is for. And then they're supposed to give the money back if they didn't spend it all, which they don't normally do, but that's how it kind of works in Canada.
Buenas. Mi pregunta va para Edgar Sánchez.
Question goes for Edgar Sanchez. You mentioned a series of activities I would like to know, so the staff members who work in those areas, are they professionals or are they technicians? Are they state staff members or do they belong to the communities? Can you clarify how it works? And in the Casa de Dia, have you taken into account the physical therapy, rehab physical therapy? Well, for these kind of activities, what we do and what we have is that we have the trained staff. I mean, for dental care, they are professionals. In my case, I'm a psychologist. I'm a professional. We work with thanatology for this stage that is really important when we talk about senior citizens. And, well, all these people are hired. Some of them are volunteers because we also have citizen seniors that have this knowledge and they like to actively participate, and they say, I was art historian, I would like to share, please provide a space for me to share my knowledge. So they talk about Diego Rivera, about World War II, things that I don't know. For example, we have books as well, but it's different to get to read a book, to get to listen to a senior citizen with this knowledge. So, we get involved with both professionals and volunteers and with the people who are getting the services but that have knowledge in specific areas. Thank you. Todavía me parece que tenemos tiempo para una más.
Of organisation and representation of workers. Is there one or two more people?
Bom dia a todos. Em primeiro lugar, quero agradecer à UNE e a todos aqui presentes.
Uni and all the people here, I wanted to ask, for example, in Brazil, do we have any policies that the government has to guarantee a decent payment for the senior citizen workers? Is there a subsidy for the people who need to be taken care of? Because we know that we have a lot of nursing homes, daycares, but most of the people who need care are at home. Who are the people who have low income? Rich people can get to pay private care, and they can also pay a nurse, among other things. But the people with low wages, not only senior citizens, but people with disabilities, or just people who are sick. That is something that we cannot see in our country. Many times we have people who go to our homes we get some injections and that's it. I mean, I would like to know about this, and I would like to thank to all the people here.
Okay, this is for Kelly. I thought the question was for Brazil. Can you please repeat it? Well, my question was actually for Tatiana from Brazil. Perhaps you are confusing here. Tatiana is dressed in pink. Well, it doesn't matter if it's applicable to Brazil, it might be everywhere. My question is if there is a policy in Brazil or everywhere, that doesn't matter. The most needed parties for caregiving are the poor ones, not the wealthy ones, because they can pay for a nurse auxiliary. But if there is a policy created for the people who can't afford to pay a decent wage for these care workers, but most of the times these people needing care, the same happens in Brazil. There are people needing care, but this poor salary, if there is any subsidy, perhaps this might allow them to cover these wages for elders, because they are paying taxes actually, and they are paying their contributions.
Okay, so
Bom dia, eu posso complementar o comentário dele?
I think he was asking about government subsidies, right? And how can low-income people who need access to care actually afford to access that care? So that's an open question. You want to have a go, Kelly?
Sure.
Thanks.
So, yeah, so in Canada, it's based on income. So if you're low income, if you're a senior with low income, and it's usually if you make $120,000 or less, I believe, a year, which most, they don't, then you would get subsidies. So the government would pay for your stay in a long-term care facility.
And Sister Claudia, is there something that you could add about the Mexico experience? Is there a way that people can access the childcare services if they're not on a high income? Is there any government support for that or funding?
Muy bien.
Bom dia, eu
perdão.
posso complementar aqui?
Sí, claro.
Ok. Não o que eu vou dizer não é bem uma pergunta. Só complementando.
Okay, it is not a question. I want to complement to what Jose Maria stated, because in Brazil, we lack of subsidies, neither for elders or for care workers, or these houses or residences where these people stay. Well, care workers for elders in Brazil, they are house workers actually, and we are doing this, carrying out this work with Uni America, so we can reach these care workers for elders to get some dignifying salary for them, because they get into the houses as house workers and they cook, do the chores, and additionally take care of the elders. This implies a risk, because there is this sick person in bed and they even provide them with their medications, and sometimes they have to attend them like medical services, and having no training, having no guarantees, no vacations, no labor rights. Now that we are having a dialogue with Uni Americas for the purpose of providing them with all their rights, and actually they are not aware they do have rights.
I heard from you today
Ok, escucho que hay algunos criterios para elegir y definir la elegibilidad de la gente. Y lo que escucho desde lo que dice José María, y que esto aplica en varios países, es difícil de definir. Y por lo general, parte de la sociedad no va a entrar en estas pláticas. Entonces, de acuerdo con su experiencia en Canadá, por ejemplo, ¿cuál es la influencia que se puede tener como parte de la sociedad? ¿Qué es lo que se necesita tener para poder definir quién va a tener acceso a esos cuidados de larga estancia y qué tipo de organizaciones o participaciones se deben tener para los adultos que puedan tener acceso a estas pláticas? Porque todos los criterios tienen que ver con las matemáticas de los ingresos. Se genera mucho dinero a lo largo de los años y entonces puedes pagar una determinada cantidad y la gente no está calificada para subsidios para las estancias o residencias. Tiene que ver más con el plan de retiro. Y el gobierno lo va a determinar de acuerdo con tus ingresos. Entonces, por ejemplo, mi mamá estuvo en cuidados de larga estancia, pero sí tuvo seguridad social y el plan de pensiones canadiense, y entonces fue gratuita por su situación. Hay gente que tiene muy buenas pensiones y va a depender de los ingresos que tuvieron. Y a lo mejor van a pagar un poquito más para las largas estancias. Pero, por ejemplo, mi mamá, cuando entró en este plan de larga estancia, al principio se negaba porque pensaba que ella podía quedarse en casa, pero no. Todo se tenía que ver de acuerdo con los impuestos que había pagado, y entonces esto no tiene nada que ver con tus activos. Ella pensó que iba a tener que poner su casa en hipoteca, pero y que se iban a comer todos sus ahorros y que los ahorros de las próximas generaciones. Pero no, todo esto tiene que ver con las contribuciones fiscales. Y si tienes un plan de retiro, una pensión, pues básicamente este servicio es gratuito. Ok, yo podría agregar. Escucho lo que dicen en piso, porque sí, es una pregunta muy difícil. Es difícil dar respuesta a esta pregunta porque por lo que escucho es, ¿qué pasa con aquellos que no pueden pagar, no tienen acceso a los cuidados, o ni siquiera pueden contratar a un cuidador doméstico porque no lo pueden pagar? ¿Y cómo nos organizamos para cubrir estas demandas y encima pagar estos salarios? Pero pues sí, no hay ningún financiamiento, no hay subsidios por parte del gobierno, y esto también es parte del problema. Para mí, yo creo que es la falta de organización, y por eso nos tenemos que organizar. Ese es el quiz, y tal vez es incluir a más gente en esta plática, establecer alianzas, relaciones con ellos para que los trabajadores y los que van a recibir este servicio pues establezcan estas reclamaciones, estas demandas, y entonces de ahí se generen todas esas políticas y financiamientos.
Okay. One last question. I think we're good. So, thank you so much to all of our panelists. Thank you so much to everybody listening and for your great questions. It has started a lot of good conversations, and we don't have all of the answers, but we certainly have a lot of work to do, and hopefully we can continue down this path together in solidarity over the coming weeks and months and years. I'm going to hand over to Ulysses now for some presentations and to close.
Había quedado pendiente una respuesta. ¿Habían hecho una pregunta de estancias o no? Que si personas de escasos recursos tenían acceso a la estancia
No income people having access to children's services. Of course, the children's facilities were created for the workers, for the state workers. However, the country includes public policies that determines this service provision for all the people that are vulnerable, and they will be receiving the care service in terms of service, insurance coverage.
Gracias.
And now let's hand our tokens for appreciation to the speakers. This is a token for appreciation for a speaker from Italy. The panel is representation and organization for care workers and rights for the care service.
Presidente del Centro Atense, por la Ayudameña, presidente del Centro Cientista, doctora Magdalena Rodríguez, director global de INTER Alazano y presidente del Consejo de Trabajo, Elvis Solanis Moreno.
Please give a hand. Ok, este es el certificado de reconocimiento.
From Sintiste and Uniglobal Union and Unicare, presented to Andrew Bean from the SEIU 775.
Para Jorge Bermúdez, secretario general de la Federación
Uruguaya.
This is for Jorge Bermúdez from Uruguay.
This one is for Kellyanne Moore.
Yes, sir.
Para Ruth Díaz, presidenta
de la Federación Nacional de Mujeres Trabajadoras, FENAMUTRA.
For Ruth Díaz from FENAMUTRA.
Gloria Flores.
Claudia Lorena Sánchez Bárcena, directora de la Estancia de Universidades de
Claudia Lorena.
Edgar Sanchez Hernandez.
And for our moderator, Janet Armstrong, thank you very much. So now we are going directly to our lunch break. And we will be resuming at 1:30 for the following panel, Best Practices for the Region. Thank you very much. Bon appetit.